introduction. We're not going to go too deep into the clinical side of things. If you have more clinical medical questions, I'm going to kind of push that over to Miss Nancy over here, who's the nurse practitioner here at the clinic. So any more, basic questions that I can answer. If I can't, I'm just going to pass it off to her. But mainly, anything that's super in-depth, consultation would be best. So that's what, would be best for anything super in-depth. So again, it's going to be very, very basic. We're really just going to be talking about the hormones that are associated with a lot of the symptoms that we deal with: joint pain, fatigue, insomnia, anxiety, depression, all the good stuff. And then most importantly, some of the misconceptions out there that kind of give hormones a bad name or taboo per se. But this therapy is becoming very popular, and not because it's opinion-based medicine. Everything is evidence-based. So everything that I'm discussing today within this PowerPoint, there's medical literature, medical study to back it up. So I like to throw that out there because I think a lot of people do have kind of that weird thought about hormones, but this is all evidence-based. So everything we do is safe and efficacious, and we want to preach that because we would never do anything to harm patients. So what are hormones? Hormones are chemical messengers that basically send the proper messages and signals to our body to be able to function properly. As we age, we have less hormones to come in and basically protect ourselves and our organ system. So I like to kind of talk about an analogy with our cell phones. Our cell phones are used to call and send messages. If we didn't have our cell phones, we don't have anything to send the proper instructions or the proper message to our receiver. So what we really want to focus on here is kind of just replenishing what our body no longer is producing. And that is going to be testosterone, progesterone, estrogen, and thyroid. Thyroid's a small hormone, but it's a powerhouse. And so I think a lot of people, when they think of hormone replacement therapy, they think of testosterone and estrogen, but they leave vitamin D and thyroid out, and those are really big pillars of just hormone optimization in general. If your thyroid's not optimized, you may not have the best experience, or some of those things that you're looking to kind of solve and resolve may not be resolved with the pellets. So we have to look at the bigger picture with supplements, thyroid, how are your progesterone levels? Is everything balanced where we need it to be? But these are the top 4 hormones that we will be discussing. So I like to keep it on the screen for a second, and we'll do a little bit of an interactive here. But out of this list, how many symptoms? We have 4 or more symptoms on this page: moderate to extremely severe.
Hi, everyone.
Yeah, that's typically how it goes. And most of the time, they have every single one of these symptoms, and so that's what we're really going to be discussing today: is how hormones correlate to that. And I know we were discussing before we started our presentation about semaglutide and tirzepetide. So before we kind of dive into that, I do want to discuss just the correlation long term. So everyone's on semaglutide, everyone's losing weight, everyone's feeling good. Problem with that, and we were talking about this earlier, is people aren't eating. And so with that being said, is we're losing a lot of lean muscle mass, and lean muscle mass is so important. And also prioritizing protein and strength training and resistance trainings and things of that nature.
What are you talking about now? You're talking about
semaglutide.
So that would be like, I was taking Saxenda. Is that what that would?
So that's a different.
That is similar, but not the same.
Okay, because I was not hungry at all.
Right. Yeah, it's the same class, but it's a little different.
Okay.
So all these, work the same way.
Okay.
They're all just a little different.
Was it helpful for you, or?
I mean, it was yes, it was helpful, but I hurt my knee, and then I was trying to do exercise. I hurt my knee, and then I hurt my foot, and I couldn't do any of that for like a year. It was a year ago, actually, now that I was taking Saxenda, and I was actually doing well with it. Got extremely sick. You have to like be sure that you put the right dosage in. If you don't, you'll get deathly sick.
Oh, okay.
Wow.
Because a lot of the like the Ozempic and I mean, this isn't part of this, but sort of part of it is a lot of them make you very nauseous.
Yes. Yes.
Which I couldn't. Yeah, I was nauseous when I was pregnant with my girls, and that was the worst feeling for 3 months. I would never want to go through that. And that's the good thing about we do Tirzepetide here.
Right.
And so very few people, my daughter's on it and is doing really well on it. She feels a little nauseous the second day, so she prescribed a prescription for her to like help with that. Mm-hmm. And it was just really one day of nausea at the very beginning, and now she's much better. Okay. But most of us, I mean, I've had zero nausea at all on it.
Same
So
with me. I have not experienced nausea.
Mm-hmm.
feeling of fullness, but that's a good thing.
Yeah.
Right.
Yeah, so we have that here if you're interested in finding out more
Yeah,
information.
that's why.
Because I've lost 30 pounds and feel amazing.
Yeah,
and
that's
so,
kind of why I came. My friend, she's the one that's been on that.
yeah.
And so I was just curious about, I didn't mean.
So, no, but it's good, and,
Yeah.
you
I
know,
like the questions.
Yeah.
but that's the reason we did this and kind of a thing together is because, you know, a lot of women, a lot of people, but especially a lot of women have problems with both things, and it's like,
Right.
okay, we can help you with the weight loss, but more
Hormones.
more likely,
Yeah.
all that other stuff is screwed up.
Yes.
So in
yes.
order for us to, you know, fix everything, we got to do it. And a lot of times she tries to separate them a little bit, just so we kind of know what's going on
Right.
both of them. But yeah.
Yeah,
both
no,
need to
I
be
mean,
done.
I've got a hormone issue that I haven't ignored.
Yeah.
Yeah.
Yeah, we were
For a
talking
long
about that a
time.
little bit, yeah.
Yeah, and that needs to, that's probably one of the reasons why I'm having these problems.
Yeah.
Because I never used to have weight loss issues.
Yeah.
Well,
Till I took-
none of us
Well,
did.
Yeah.
And it just goes right down the toilet after that.
Yeah, and the Tirzepetide, it just activates 2 receptors instead of 1 like the semaglutide. And again, it's a great thing to kind of kickstart that weight loss.
Right.
Get it off, get a good amount of weight off to start, and then the hormones come in and help you with the lean muscle mass and keep the weight off.
Okay.
Because it kind of works with your body and it works with you from an hormone optimization. So testosterone is one of those big things, and we'll get into that
Okay.
from a lean
All right.
muscle
Sorry
mass.
to-
Oh, that's
No,
all right.
Ask all the
This
questions.
is a discussion.
Exactly.
Okay.
We encourage that. So
Okay.
menopause, the facts. You are considered to be in menopause 12 months after your last menstrual cycle. I think we all know that. But your ovaries decrease the production of testosterone, progesterone, and estrogen. Oftentimes, specifically in women, testosterone is the first hormone to become depleted. Men, they can go a little bit longer before they go into the tank, but us females, because we have so many other things going on, we tend to see a decline in a lot of those things very quickly. So testosterone is the first hormone to stop its production, and then everything else kind of follows. So a lot of the time people are, especially females, females get testosterone. Testosterone is one of the most abundant hormones found in our body. From a breast protective standpoint, brain, bone, there's receptors found on all parts of our body. So I always like to say the 3 Bs, if there's one thing to take away from here, it's not masculizing, you know, you're not gonna grow facial hair or turn into Superman, you know, we're not here to push you guys up to these super physiological levels. We want to just get you into the optimal range of those lab ranges, and we'll go into a little bit of, you know, what normal and optimal really means. But really, we want to focus on testosterone, estrogen, and of course thyroid and vitamin D. So osteoporosis from the onset of menopause to about age 60, women lose on average 25% of their bone mass, and that's directly due to an estrogen decline. Estrogen plays a big role in bone health and laying down new bone to continue strong bone health as we go through our aging process. 80% of osteoporosis patients are females, and menopause is a sex-specific risk factor for just that. Because our estrogen depletes, again, it just goes back to where our body isn't signaling to lay down that new bone and to keep that bone nice and healthy. So going back, menopause is a sex-specific risk factor and decreased bone density and fractures. Cardiovascular disease, same thing. 5 times more women die from heart disease than they do breast cancer. And so kind of going back to the hormones and kind of having that taboo, people think, oh, well, hormones are going to cause cancer and blood clots and strokes and all these things. And that's just not the case. The Women's Health Initiative was kind of the study that came out in 2012. Do you remember exactly what it was? It was early 2000s, and it basically came out, and it was a study focusing all on synthetic hormones. So your Premarin, your Prem-Pro, your conjugated equine estrogens, which is synthetic estrogen. So everything that we're talking about here is bioidentical. It's what our body naturally produces, or did naturally produce when we were kind of keeping on that track. Those who started hormones saw a 50% reduction in cardiovascular disease. And that's a huge statement. If we can reduce all-cause mortality by 50% just by optimizing our hormones and getting us back to where we were when we were 18, 19, 20, producing these high-level hormones, no one had cancer or strokes or blood clots when we were 19 and we had high estrogen levels and high testosterone levels. It's just a decline, and all we're doing is replenishing what our body no longer produces. Estrogen, just a little bit of fun facts. It has over 400 functions in the body, and estrogen does play a big role on sexual health. So painful intercourse, if some of you ladies kind of go through that, dryness, that is all estrogen related, and that's just a deficiency. It does maintain vaginal blood flow and lubrication, so kind of going back to painful intercourse, most of the time it's because it's dry and there's lack of lubrication there, or there could be some other factors that play a role, but it does regulate just how you are sexually and how your body functions in that region. Estrogen is responsible for both the intensity of orgasms in men and women. So going back to just sexual dysfunction is directly correlated to some type of hormone imbalance. So low libido, again, lack of lubrication, painful intercourse, all of those things. Again, same thing, hot flashes, anxiety, depression, mood swings, vaginal infections, so yeast infections, things of that nature, joint pain, dry skin, decreased bone mass, bloating, and memory lapse. These are all things of just, again, hormone deficiency. So we'll briefly touch on progesterone, and this is just for my women, but progesterone is produced in the ovaries. Once we hit menopause, that goes to absolutely zero. And progesterone and estrogen work together to create the synergistic balance within the body. So when our progesterone's not kind of where it needs to be, and then our estrogen's all whack, and now we're all off balance everywhere, that's where all of those symptoms start to rear their ugly head. So progesterone moderates many effects such as fluid retention. So if someone tends to hold a little bit more water, it does kind of help as a natural diuretic, which is really cool. Bloating, headaches, and it does have synergistic benefits on bone and lipids as well. Progesterone receptors are found throughout the body, not just the uterus. It's kind of all over the place, and especially if someone has had a hysterectomy. And I think a lot of people get a little crazy. It's like, well, I've had a hysterectomy, I don't need hormones. Well, actually, it's kind of opposite. You need them more because now your body is not producing what they're supposed to produce because you got a hysterectomy. So those who have had a hysterectomy or a partial hysterectomy, you guys need this even more. Progesterone is very uterine protectant. It does help regulate sleep at night. So typically, if this was a part of the treatment plan, you'll kind of get that to take at nighttime, and that does help regulate your sleep, which is really cool. Progesterone functions kind of went in this, but it does kind of play a role in metabolism and help promote weight loss. So it all works synergistically with each other, with the testosterone and the progesterone and the estrogen and Tirzepetide and things of that nature. It all works synergistically. Again, it acts as a natural diuretic. It does stimulate production of new bone, and that is in correlation and in direct contact with the estrogen kind of working together. Enhances action of thyroid hormone, alleviates depression and reduces anxiety, and then again promotes normal sleep patterns. And typically the sleep patterns are what I hear the most on, is they take it at night and they sleep good, they stay asleep, and they wake up feeling refreshed. They don't wake up feeling groggy and just like I can't get out of bed. They feel good, so it does help regulate that as well. So this is for my males here, my only male over here. But andropause is pretty much menopause for males. They go through the same thing. They become deficient in testosterone, linked to early heart disease. So typically men that you see with cardiovascular disease or diabetes or sleep apnea or COPD, those chronic diseases, typically their testosterone levels are pretty dang low, and there's some type of deficiency there. So testosterone helps kind of regulate and prevent a lot of these chronic diseases, and there's going to be a really cool slide that we'll go into that kind of gives you a good visual, but it helps really regulate some of those chronic diseases. And what we're wanting to do is really prevent. We want to get ahead of this so that we don't get diagnosed with diabetes or heart disease or have a stroke or whatever it may be. So we're all about preventative medicine, and that's kind of what we're doing here. And having someone like Nancy who kind of gets an overview, not just a few of these labs and your typical labs that maybe a PCP would pull. She gets an overview of thyroid, your testosterone, all your hormones, and really to see exactly what's going on. So typically most people just, for example, for thyroid, most of the time just a TSH is being drawn. So we have to look at the bigger picture, and Nancy kind of does all of that from a blood perspective. Testosterone present in both males and females. So for females, ages 20 to 40, we lose up to 50% of testosterone a year. Men, they only lose 1 to 10% a year. What is this? It's always men. They just have it so easy, man. But men, ages 30 to 70, will lose about 1 to 10% a year. But that's a big chunk over years and years and years.
Hey, we die earlier than you guys.
Yeah.
You have that. Yeah.
Okay, fine. You can take that. No, but seriously, so with the females, I mean, it gets lower and lower and lower, and it doesn't help that we live in a very, very toxic world. The body wash we put on our body, the hair wash we use, the face wash, the food we eat, everything has some type of hormone disruptors, and that doesn't help with your body's trying to work with you. It starts to work against you because all these things start to disrupt. So that doesn't help, and there's definitely ways that we can try to stay away from some of those toxic things, but you know, it's a very toxic world, unfortunately, but there's things that we can do to kind of prevent that. And then kind of going back to remembering the 3 Bs, testosterone is brain, breast, and bone protective. So everyone that says, you know, it causes cancer and blood clots and strokes, I mean, that's just simply not true. And the Women's Health Initiative kind of initiated all of that. And then the great part is that they came out in 2017 basically saying the study was false and it was not accurate. And so a whole generation of women kind of went without their hormones. And so, you know, you had increase of all-cause mortality and fractures, and it was a mess. And it's unfortunate because a lot of people did kind of lose the benefit of what hormones really have to offer. So this is a nice one. We kind of went through all of this, but increases bone density and strength, healthier body composition, improved muscle tone, and that kind of goes back with the Tirzepetide and doing the weight loss programs. Yes, it suppresses the appetite, and some people don't eat. They don't, and we have to focus on that, whether it's a protein shake or a protein bar, or just getting something in the system to kind of prioritize that protein, because what happens is we're losing that lean muscle mass, and it's hard to get back, especially if you're in, you know, going through the menopause and perimenopause. It's tough to get the lean muscle back. So we want to be able to maintain. So whether that's with other peptides or hormone optimization, we have to maintain that lean muscle mass. Higher energy levels, better emotional health, restoration of libido. Libido is a big one that comes back. Typically with the testosterone, it does help with like sexual dysfunction. You know, more collagen production, better looking skin, decreased body fat, decreased cholesterol levels. I could go on and on. I mean, who doesn't want all this stuff, right? So we really just want to focus again on prevention, and all of these things come with us just optimizing hormones. So this is what I was talking about with the normal and optimal blood range. So typically you go to your PCP, you know, your blood work, you're going through all your blood work, you have a testosterone level at 9 and they say you're normal.
Well, you're in the normal range.
Yeah, you're in the normal range. You know, you have weight gain, insomnia, low libido, anxiety, depression, can't sleep, you know, you can't do all these things, but you're normal.
But everything's normal.
But everything's fine, right? So we really want to focus on optimal. So I like to kind of bring it back to school where we had our little bell graphs, right? We have 3 different quartiles. You have your lower end, your middle, and your upper. We want to stay on the upper end of that quartile. So when you're looking at these lab ranges, when you get your blood work back, I mean, that's ages 1 through 80 of a very sick population. We don't want to be in that range because it's on a sick population. Who wants to be sick? We want to be on the upper level of the optimal range. So it's showing in the front a total blood serum of 345. This person feels lethargic and is depressed, can't lose weight, and then you have the same exact individual with the same exact 345 blood range, but they run half marathons and feel amazing. So this slide is really not to compare, because everyone's bodies and everyone's genetics and journey is so different. I think a lot of people are like, well, she lost 50 pounds on Tirzepetide, and I've only lost 10 pounds. Well, okay, have we looked at the thyroid? Have we looked at hormones? Have we looked at some of these other things that may be stopping that from happening? So this slide really is just don't compare your blood levels, don't compare your journey to other people's, because everyone's ranges are different. Typically, females feel best between like 150, 250, yeah. And some are a little bit higher, some are a little lower. Everyone's a little bit different, and not everyone's range is exactly the same. So don't compare yourselves. Everyone's journey is a little bit different.
So when you get blood work, that's the.
No, so
what you
this
get?
is.
Oh, this just is a
So this right here,
visual of.
yeah.
Okay.
And I mean, really, this right here, this would be showing you what the women's optimal range would be for
Okay.
total testosterone, and then this is males. So typically, males are on the higher end
Yeah.
because they're getting a little bit
I
more than
gotcha.
us.
I gotcha.
But yeah, typically your optimal level for your total testosterone, if you were to get your blood work and move forward with hormones, is between that 160 and 300 range, or 150 and 250.
So the blood work that they do is about $1,300 worth of blood work that they have a
Discounted
relationship,
pricing.
yeah, with the company. So you know, we charge $150 for the blood work, but it's $1,300 for the blood work, and we accidentally put it through our insurance instead of paying that one time, and they charge us $1,300 for it. And it took us almost a year to straighten that thing up. But it'll go over everything, like you said, the vitamin D level, the thyroid level, B12. So tons of different things that can all affect your hormones besides just your hormones.
Okay.
So once we get that back, and most women that are not feeling great, have testosterone levels of like 5 or 10. And so, then right away we see that, but there's also those other issues that could be going on also.
Absolutely. And we kind of went over that, so I won't go in there, but the benefits, I mean, what we're going here is we're just replenishing what our body is no longer producing. I mean, when we were back in our 20s and our 30s, we had energy. We had the lean muscle mass. We had
Sex drive.
The sex drive. I mean, we had it all. And that's because our body was producing what it needed to produce. So as we age, we just don't produce it anymore. And that doesn't mean we have to suffer.
Yeah.
We don't have to suffer. There's a treatment plan for this. There's different treatment options. And, hormones may not be the magic bullet. Again, there are other things that could be playing a role in it. But we really just want to focus on getting that number to an optimal level. And it's all based on the patient and how the patient feels. I mean, we're very conservative with dosing. We like to say that as well. Dosing is key. So we like to keep it very low. We don't want, again, to jack you guys up to super physiological levels and have crazy whatever turn into superwoman. Yeah, we just don't need that, and we don't want that. We just want to get you feeling good and have a good quality of life again. So we're going to go into what are your options. Because there are other options aside from pellets. We specialize in hormone optimization with pellet therapy just because it is a more superior delivery method, and we'll kind of go through why. But some of your other options are you have your patches. So patches is one thing. Problem with that is you have adhesive issues, you have compliance issues, because now you got to put on a patch all the time. There you go. So you have a personal testimony.
I did, and they fall off.
Yeah.
I was wasting so much money because I would just like sweat at the gym. I hate it, horrible.
Yeah.
And you never really, just it was scary.
Yeah, and unfortunately, with a lot of those things, women start feeling a little bit better, but they're like, oh my god, I feel a little bit better, but I want to feel much better.
Yeah.
And then once they get on the pellets, and they're like, okay, now I feel great. But it's like a little teaser of those things.
Exactly.
But it doesn't really help you.
Exactly. Here.
Yeah.
But then 55% of people don't even absorb the
it was
hormones.
good.
So it's like our body is meant to keep things out. So when
Yeah.
you start to put creams and that thing, depending on the individual, they
You
may
start
not
getting hair
absorb
where
it.
the cream goes
Yeah,
and all kinds of
exactly.
things.
So, it's
a lot.
not ideal, but some people get a little, we have options. There's options. But with the pellets are going to give you the best steady stream of hormones without all the compliance issues, and we'll go into that. Creams and gels, very similar to that. You're having to rub it in 1 to 2 times daily, short half-life, and like you said, it can transfer. If you have grandbabies, if you have pets, if you hug someone, if you rub someone, now your testosterone cream is now absorbing into your grandchild, and we got to keep that separate.
I had, and this is an interesting story.
It's
I
a
had
real
one
thing.
client that she needed it really bad, and she had a child that I forget he was autistic or something, and was having crazy side effects, all this stuff. So they looked at his testosterone level; it was through the roof, and it was because the mother was holding them and was putting creams on, and it was actually going right into the mother.
Crazy.
Yeah.
So that's a little, we want to keep that separate, obviously.
Yeah.
So that's, again, it's very inconvenient. It doesn't absorb well. And you're just not getting that same protection that you would with the pellets from a bone, breast, and brain standpoint. So that brings us into injections. Typically, males are really the only ones doing injections. You may see females on injections sometimes. You don't typically see it. The problem with this is it's 99% synthetic. It's mass produced within a lab. And
It
then
hasn't been studied well in females, so I don't.
No, I would not
for the
recommend it.
injections. It's just not very well studied.
Well, no, and the problem with that is you get that rush. And when you have too high of hormone fluctuations, that's where you get the side effects. Is when you jump up to these super crazy levels and then you crash. And then you jump back up again and then you crash back down. So you don't want those roller coaster effects with the hormones. I mean, that's where a lot of those side effect profiles start to take place. So liver toxicity, heart disease, elevates the bad cholesterol, or elevates the good cholesterol, elevates the bad cholesterol, decreases the good cholesterol, and it always wears off before the next time. They're having to take 52 shots a year. It's a pain in the butt. I mean, it's intramuscular. Yeah, it's literally a pain in the butt. Good one, Nancy. That's a good one. But yeah, I mean, it's a pain in the butt. We'll just leave it at that. So they do have to do 52 shots a year, and some men are okay with it because they do like that rush, but there's better options.
But they also have the crash.
Exactly.
Yeah,
And they also have the side effects. But some people just they want that rush, and that rush isn't always good, especially from a hormone standpoint. So what Nancy specializes here is the bioidentical pellet. So everything is natural. It's derived from yams specifically, so it's all plant derived. It's the same like molecular structure as what our body naturally produces. So what our body produces from a testosterone standpoint, progesterone, estrogen, the pellets basically mimic that. So I like to call it endocrine mimicry. Our body mimics the pellets mimic what our body naturally produces. Typically on females, the therapy lasts about 3 to 4 months. So you get pellets inserted about 3 times a year. Males, it lasts about 5 to 6 months, and they get inserted about twice a year. It is the most widely studied form of BHRT. I mean, pellets have been around since the 1930s. There's tons of medical evidence from a heart health standpoint, from just overall protection with breast cancer. I mean, there's a really good study. Rebecca Glazier, she's a provider out in Dayton, Ohio, and she actually had a patient that had breast cancer, and she used testosterone pellets to reduce that tumor mass size. So that right there just shows you it's not causing cancer. We're reducing cancer. We're actually protecting those who may even have had a breast cancer. Testosterone is breast protective. So that was a really cool thing to see. But provides a steady stream of hormones into your blood. So typically it's about a 5-minute procedure. The only thing you feel is a little prick from the lidocaine that numbs you up. It's a little incision. They take a trocar, they place the pellets in. It's in the glute area. And then they just take a steri strip and they just steri strip you up. So no stitches or sutures or anything of that nature. It's inserted, they put a steri strip, and then you're on your way. So typically we don't recommend exercising within those 3 days, but most of the time you can pretty much kind of get back to your day-to-day within 24 to 48 hours. And it is individualized dosing. So everything from a dosing standpoint is based on your symptoms, your labs, your medical history, your age, weight, height. It takes all of that into consideration. Activity levels. Because the way the hormones are kind of absorbed is based on cardiac output. So whether you're physically active, emotionally stressed out, whatever it is, once that blood is pumping and going, that's when the hormones are being dispersed. So it does go based off the cardiac output. And so if you're less active or less stressed, you may be able to kind of extend that therapy. If you're a little bit more active, you may go through that a little bit quicker.
But you also find what I found is I had a really bad car accident a couple years ago and had a couple other things that happened, and I went through my pellets really quickly. But we found out it was just from all the things that were going on in my body. So that's why and you'll see once you're on it for a while, the second it starts wearing off, you feel it. And for women, especially that don't have periods anymore, you feel like you have PMS again, which you don't have anymore. And then you're like, oh shit, I need my pellets. So you realize when that time is, and then you find that optimal time.
So your husband will remind you.
No, you know better.
So it's so true. It's so true. And she's just a text away, so super helpful.
Yeah, even Christine, that is always perky, and then she'll be like, oh my god, I feel like such a bitch today. I need my pellets today. You know, like,
what is wrong with me? Is it time?
you just feel it, and then you're ready.
I love it. So it is all individualized, and that's really key when doing pellet therapy. Is dose is key. So we like to keep it very conservative, and it goes based off of all those different kind of things that we input. And then it is inserted under the skin, but it's pretty quick and painless. I think everyone can kind of vouch for that. I mean, you really don't feel anything other than that initial lidocaine prick. Once you're numbed up, it's fairly quickly from
Very
that.
easy. Nancy's very gentle.
Yeah, she is gentle.
She's gentle.
And then lastly, we're just going to go into the importance of supplements, because supplements is key to this therapy as well from a methylation standpoint. So it just helps the therapy overall get everything where it needs to go, but also vitamin deficiencies. We're very deficient in vitamins. We don't get it through our diet. We don't get the proper nutrients that we need from our food. So supplementing it with some type of quality vitamin is very good. So approximately 59% of the tested products and supplements contain plant species that were not disclosed on the label. So there's always ingredients that are in the product that aren't actually disclosed on the actual label that you see. So there's always fillers or contaminants and toxic products that are added into these supplements that are not addressed, and we just have no idea about because they weren't on the label. So about 43% of those products lacked any trace of the primary ingredient stated on the label. So all these things that you're buying from Walmart and Amazon and GNC, they may not even be getting what you're paying for. So that's super important to look for pharmaceutical grade supplements, quality, they're potent and they're safe, they're third party tested. So everything that we test is you're showing the potency and the purity of that product. What we're saying we're giving you is what we're giving you based on that. So it's very important to just keep that in mind when going out and looking for supplements, because Most of the time we're vitamin D deficient, those labs come back and our vitamin Ds are in the tank, so vitamin D most of the time will be part of that treatment plan. But getting a quality vitamin D is important because now you're paying for money and not even reaping the benefits because the ingredients aren't in there. So it's very important to just keep an eye on that as well. I believe that's it. Does anyone have any questions specifically? I know that's a lot of information.
I always tell the story about the vitamin D. Is our friend from Pittsburgh flies down fairly often, and she was vitamin D deficient. We found out, and she went to Costco and bought vitamin D, and was taking supposedly 10,000 units. And then we did our blood work again. It was in the tank like it was before. So for a month, she was taking what she thought was 10,000 units from Costco and did 0. So all the money you're spending on what you think you're saving on did her no good whatsoever. So you got to be super careful with those supplements.
Especially with Amazon too, I think like everybody orders from Amazon, and I'm a huge Amazon order.
Me too.
You don't
Me
even
too.
get what you don't even know like what you are getting
Yeah.
because it's
Or where it came from.
Yes.
This place it was
Yeah,
in, warehouses.